If you need help with an appointment or a medical question, please call our health system at 312-864-0200. Again, that number is 312-864-01200. My guest tonight is Dr. Claudia Fegan, and she's the Chief Medical Officer for the Cook County Health and Hospital System. As a top doctor for the health system, she is in charge of developing and fostering clinical standards for Stroger and Provident, all of our clinics, and the healthcare facility at Cook County Jail. Welcome to the show, Dr. Fegan.
Thank you. Glad to be here.
Thanks. So February is American Heart Month, and high blood pressure is a key risk factor for having a heart attack or a stroke. For those who know that they have high blood pressure, what can be done to sort of deal with that?
Well, high blood pressure is a very common condition in this country, and people who have high blood pressure need to have their blood pressure measured regularly. They need to take their medication. They need to be on a low-salt diet and attempt to have a good diet and exercise regularly. Get a good night's sleep. These are all things that help to lower your blood pressure, trying to manage your stress. We live in very stressful times, and there are lots of things that we can do that will help reduce our stress. Exercise is a very good way to reduce stress, and our diets tend to be too high in sodium. People have a habit of adding salt to everything they eat. And trying to get people to eat healthier with more leafy green vegetables, more fresh fruit, and less processed food. So preparing their own meals instead of eating fast food is an important way there. So there are lots of lifestyle changes we can do that help to lower our blood pressure.
Sure. And February is also Black History Month, which makes it a great time to talk about Provident Hospital. And I was just wondering, can you fill us in on what's new at Provident Hospital?
Yes, so Provident Hospital has been around in the community for over 100 years. We're very proud of that. The first blood bank was at Provident Hospital. The first open heart surgery was done by Daniel Hell Williams at Provident Hospital. The first blood bank was actually at Fantis at Stroger. But Provident Hospital was opened at a time when Black physicians could not get admitting privileges to many of the hospitals in the Chicagoland area. And so we have been in the community for many years, and people have forgotten about us, but we're actually preparing to build a large new outpatient facility at Provident that will have outpatient surgery facilities and considerably upgrade our ambulatory facilities for patients. So patients will be able to access all kinds of specialties. We currently have cardiology and pulmonology, gastroenterology, and nephrology, and a very busy medicine clinic at Provident Hospital. We're happy to see patients in the community who are looking for primary care physicians. And we're excited about this new outpatient facility, which will offer our patients much fancier, more modern facilities in which to receive their care. We want to be the provider of choice for people on the south side of Chicago. We have behavioral health there every day. We are open evenings, and we're open every Saturday. So we're trying to bring people health care in the community where they live, as opposed to having them to travel great distances. And I think that people should try us, and they'll be very happy with the services they receive.
Great. And I'm just curious, for African Americans, what are some of the health risks that they should be concerned about, they should know about?
Well, I think that people forget, we get focused on what's in the news, but heart disease is the #1 killer of men and women in this country. More women die from heart disease than die from breast cancer. So it's very important for people to think about what their risk factors are: being overweight, not exercising. People say, well, I have to walk a lot during the day, or I have to, my job is very physical, and so therefore exercising is not as important. It's always important to exercise. Exercise is a way to exercise your heart. It gets it moving, gets the heart rate going, you're breathing fresh air, and you're actually exerting yourself And this actually helps you to reduce your mental stress as well as to burn calories, to help you control your weight. It helps you sleep better at night. We know that people who get a good night's sleep, who have a good diet, do better, have less heart disease, and when they have heart disease, we know that this helps control it. We know that exercise helps to lower your cholesterol. We know that exercise allows people to control their blood sugars, because diabetes is something that also contributes to heart disease. So there are lots of things that we can do. We don't like to change the way in which we do things in terms of lifestyle. But actually, we've gotten into the sedentary lifestyle where we're watching television all day, or watching the TV screen, or reading the computer screen, and we're not getting a lot of exercise. So things that we can do that will increase our exercise, whether it's we don't want to go to a gym per se, if we just walk to the grocery store as opposed to drive when you only need a couple of items, if you walk up the stairs instead of taking the elevator, if we park a little further away from where we're going, finding ways to incorporate activity into our daily lives, we do better. We control our blood pressure, and we decrease our risk of heart disease.
Okay. And you talked about the outpatient center that's being built at Provident, and I also wanted to talk about our new state-of-the-art health center that's coming
At Stroger.
Yes.
So on the West Side campus, we're building a new multi-purpose building. It's going to be 9 stories high. We're going to have a large dental facility, and I think that dental services are something that are really lacking in the community. Over the last few years, the number of dental schools in the country have decreased. People's access to dental care has decreased. So we're really excited about having outpatient dental facilities in our new building that will be on the west side of Chicago. We were going to have ophthalmology services. We have a very busy ophthalmology service now, but the new facility will have a large ophthalmology service. We're going to have the entire floor that's going to be dedicated to cancer treatment, cancer diagnosis, and treatment. And that will be a convenient place for patients to see the medical specialties that they'll need for the treatment of their cancer. So it's the opportunity to provide these services in a nice new facility that will be very accommodating. We have a very busy dermatology clinic right now, and it's probably crammed into too small a space. So this new facility will allow us to provide those services in a much more pleasant environment. And infusion services, which are the chemotherapy that patients receive for cancer, will be located right next to the diagnostic and the services for the doctors who will be talking to patients about their conditions. So this facility is going to have a lot of, nice new facilities, but also will allow us to spread out and provide the services that don't move into the new building in the hospital as well, in a much more pleasant environment. So we're excited about it. I think our patients, they deserve to have a much better facility. We're tearing down the old Fantis building, which has been around since 1959, and it served us well. I mean, at one point we had 2,000 patients a day walking through that building. So the idea that we're able to give our patients a modern facility that will be state-of-the-art, brightly lit, with the electronics that patients should be able to have, so we can show them films and educate them about their conditions in a state-of-the-art facility. I think it's long overdue, and I think that the patients will be excited to come and see their physicians in the new facility.
Yeah, I think so. And we've covered a lot already, but is there anything else that's going on at Cook County Health and Hospital System that you'd like to share?
Well, we're always trying to make sure that we are changing to adjust, changing with the times and adjusting to the needs of our patients. So, people used to travel great distances to come and sit all day at Fantis Clinic. Some people call it Fantasy Clinic, but we are with the new facilities, not just at Stroger and the new facilities at Provident. We're also planning new facilities within the communities, because we think the community centers, we would like to have dental services available to our patients in the community. So we have online intention to build 3 new facilities within the next 2 years, and each of those will be large facilities. We'll have dental services at each of our facilities. We think that behavioral health and dental services should be available at each of our facilities, and it will take a little bit for us to make that transition, but we're planning to add them into the new facilities that we're constructing. So I think the patients will be excited to see that they have new state-of-the-art facilities with the electronics already built in, with the dental facilities there, with behavioral health. I think that our society as a whole has been way behind in acknowledging the importance that behavioral health plays in wellness and helping people to cope with stress and the challenges of our society today. So we don't think that we should have primary care providers out in the community without having available behavioral health, whether it's licensed social workers, or whether it's psychologists or psychiatrists, to assist people. You know, for many years people didn't want to talk about depression, talk about post-traumatic stress disorders, and yet these things exist, and not talking about them doesn't mean that they aren't there, and not providing people the services they need to deal with these, just to help parents, for example, in dealing with the stress of raising a child in an environment where you're afraid for their safety and you're worried about whether you're doing the right thing for them. So it's not a sign of weakness to acknowledge that you're having trouble and asking for help. And we, as the Cook County Health and Hospital System, are trying to be there for our patients and provide the help and assistance that our patients need. And that includes behavioral health, that includes oral health, and that includes putting more services closer to the patients where they live.
Sure. And we've talked a lot about kind of the specialized care, so the dental care and the behavioral health. Mm-hmm. And I was just wondering, can you also speak to why it's important for people to have a primary care doctor?
So I say that when you have a hammer, everything looks like a nail. So if you go to a surgeon, they can find something that they could do surgery on. And if you go to a specialist, they're going to look for anything that's going on with you that might relate to their specialty. Mm-hmm. A primary care physician is supposed to look at the whole person and then make recommendations about whether or not you need to see a specialist and what kind of specialist, what's the appropriate specialist to see for what condition you have. Sure. So you may have a pain in your belly. It may be something that the primary care physician can manage. On the other hand, it may be something that needs to be managed by a specialist, but does it need to be managed by a surgeon? Or does it need to be managed by a gastroenterologist? And if it's a gastroenterologist who specializes in the GI tract, is it a hepatologist? So the primary care physician should help you navigate the complexities of the healthcare system and help you find the appropriate specialist. And so they should be, the overseer in terms of making sure that we get you to the right specialty care when you need it, when it's appropriate. And when it's not, sometimes it's not so complicated and that the primary care doctor can treat it and manage it. Sometimes they need to send you to the specialist to answer a question, and then the specialist sends you back, and the primary care physician will manage the problem.
Got it.
So.
Yeah. And then for people that they maybe suspect that they have something going wrong, or there's an issue that they have, mm-hmm. and that there may be something going on with them, but they don't want to see a health doctor because they're kind of afraid to get that bad news.
Right.
Kind of what would you say for those people? Why would you say that's like the wrong mentality?
Well, so that I get that a lot. One of the reasons that women don't want to go get a mammogram is because they don't want bad news. But if you have a condition, it doesn't go away just because you pretend that it's not there. If you have breast cancer, diagnosing it early means you have a chance at a cure. If you have what you think is something really terrible going on in your chest, or a cough, ignoring it doesn't mean that it just goes away or that it's not a problem. And what you do by not seeing a specialist is that you lose the opportunity to treat what may be a curable disease.
Sure. That's a good point.
Is the caller?
All right. Go ahead, caller.
Hello.
Yes, hi.
I just wanted to say that I really appreciate the Cook County hospital and health systems. I was sad to see some of the old buildings being demolished, but it's nice to hear about the new facilities. My wife in the 80s, when she was a teenager, went to Fantas for cancer treatment and her chemotherapy. So she always talked about taking the bus to Fantas and getting her treatment there. So I want to encourage viewers to use your system and appreciate it.
Well, thank you very much. We appreciate the support. We always take pride in the fact that we provide what I think is the best care available to our patients, because I think who doesn't deserve the best care that's available?
Absolutely.
And we have a lot of very dedicated physicians and clinicians who are committed to the community we serve. So we enjoy coming every day and taking care of these folks. And I'm really happy that the taxpayers have continued to provide support so that we're going to be able to continue to provide this care in a newer, more modern facility.
Yeah, absolutely. Thanks for the call. And then the White House recently has, talked about states giving their ability, they have the right to possibly make Medicaid coverage depending on whether they have.
So they're talking about requiring people to work in order to receive Medicaid benefits. And that's a really slippery slope. It makes the assumption that you're lazy and that if you're not willing to work, you shouldn't be entitled to benefits. Some people are not able to work, and some people are difficult to employ.
Sure.
And so requiring someone to find employment when it may not be available to them in order to entitle them to benefits is problematic. What I find is that people who we treat who are healthy, people want to work for a living, they want to provide for themselves as opposed to being dependent. I think we're making the worst assumptions about folks when we require that. But the problem requiring people to have employment is a difficult one in order to entitle them to medical benefits. First of all, the question is if they're able-bodied and able to work. What I find, I ask every patient that I see if they're employed. And when I ask them if they're employed, I ask them whether or not they like their job or not. One of the things I find is that when people like their job, then they are easier to manage. If they hate their job, then every cold becomes pneumonia, and every back pain becomes very debilitating. So I think that people, that work is one of the things that people can find that is gratifying. They should do it, but I think requiring employment in order to be entitled to Medicaid benefits is very dangerous.
Sure.
As a population, our majority of our patients are employed, and they're often employed in part-time jobs or low-wage jobs, and wouldn't have access to health benefits if it weren't for Medicaid.
Sure.
So I think it's an important thing for society to provide for its patients.
And for the people that are employed, do you think it'll be difficult for some of them to even show that they are employed?
Well, so there's all kinds of employment, and so if you're working as a maid and someone is paying you cash, how do you establish that's employment? Or people who are gardeners, I find that we create these laws and then we don't necessarily, what are the criteria? What qualifies as employment? And people even do volunteer work. Does that qualify? What are we seeking from them? What are we trying to achieve by requiring that?
That's a good point. And you've been very vocal about the need for single-payer healthcare.
Right.
And so I just wanted to ask you, why do you think that's the better option?
So I think that healthcare should be a right. I think that society should assume responsibility for its citizens. And that the notion of requiring your employer to pay for your health insurance is a false premise. Why should your employer decide who your doctor is?
Sure.
And if it were just a right that everyone who lived within the country, we already spend enough on health care in this country.
Right.
We spend over $10,000 per person on health care, and yet we don't do a very good job in terms of taking care of the population. It would be less bureaucracy, less paperwork, and much easier if we just decided that health care is a right, we're going to pay for it just like we pay for education, just like we pay for police and fire protection. And we could move on. It would be even cheaper to provide the care if we didn't have the huge bureaucracy about deciding who's entitled and who's not entitled to it.
Sure, that's a good point. And it looks like we have another caller. Caller, go ahead.
Hi. Hi. So I am a mother. I have a 4-year-old, and she's a little bit sick, and I've heard so many stories about the flu, and I'm very worried. She has a cough. Her temperature's been all over the place. Stomach a little bit upset, and we didn't get flu shots, which I know was a bad choice, but is it too late for us to get flu shots, or should we go to the doctor? I just need some help.
Well, if the 4-year-old has a fever and has a cough, they should be evaluated for whether or not it's influenza. It's not too late to get a flu shot, but we're not going to give a flu shot to a baby that's sick right now. We want to assess that child and have someone listen to heart and lungs and really make an assessment about whether it's the flu or whether it's something else that's making her sick at this point.
Thanks, caller. And going back to the basically the issues that kind of keep people from having health quality as they should.
Mm-hmm.
So we talked about having health insurance, but what are some other barriers, would you say, to keep people from having good quality service?
Well, so the first thing is accessibility. So people need to have health care delivered in the community where they live.
Sure.
So that it's easier to get. If you have to take 2 buses and a train to get to the doctor, you're going to have a lot. First of all, there's the challenge of car fare to get there, and then taking a whole day out to be seen. So our goal in the Cook County Health and Hospital System is to try to provide care accessible to people in the neighborhoods where they live. I think that's the first thing. The other thing is for people to be able to relate to the physician, for the physician to hear your questions and concerns, to answer your questions and concerns, and you feel like they are addressing your needs. And I tell patients, if they have a provider, a physician's assistant, a nurse practitioner, or a doctor who's not listening to them or not answering their questions, they need another provider. They need another healthcare. So the barriers to healthcare are people have natural fear and anxiety about exposing themselves to someone, a stranger, and telling them all about themselves, but you have to give your physician information in order for them to take care of you. They have to know who you are and about you in order to take care of you. So the biggest barriers in this country are insurance, because so many places, the first thing they want to know is how's the visit going to be paid for.
Sure.
So if we had access to health care for everyone, we wouldn't have to worry about that barrier.
All right. Well, thank you so much. And it's been a pleasure having you on the show.
Thank you.
And thanks so much for joining us here tonight. Appreciate it. Have a good night.